Hi, I am Dr. Sulla. Measuring and recording intake and output is a basic but critical nursing task. It helps us assess a patient's fluid balance, kidney function, and response to treatment. For patients with conditions like heart failure, kidney disease, or those in the ICU, accurate intake and output monitoring can prevent serious complications and guide clinical decisions. In this session, we will cover how to accurately measure and record fluid intake and output. This presentation has been produced under the guidance of Taiwan Medical Mission. By the end of this session, you will be able to measure and record fluid intake and output accurately, and recognize abnormal changes in fluid balance that may indicate dehydration or fluid overload. Intake includes all fluids entering the body. This can be through oral intake, such as water, milk, juice, and soup. It also includes enteral feeding via a nasogastric tube. Parenteral intake includes IV fluids, total parenteral nutrition, TPN, and blood transfusions. Blood transfusion components include whole blood, packed red blood cells, PRBCs, platelets, and fresh frozen plasma, FFP. Medications and flushes also contribute to intake and should be recorded accordingly. Output refers to all fluids leaving the body. This includes urine, drainage from wounds or surgical sites, bleeding, colostomy output, diarrhea, and vomiting. Some patients may have multiple drainage sites. In such cases, it's important to clearly label each drain for accurate recording, for example, drain A, drain B, or drain 1, drain 2. This helps avoid confusion and ensures that each drainage amount is tracked separately. To measure oral fluid intake accurately, we can use different methods. Example 1, use a local teacup calibrated by filling it with a syringe. This ensures that the exact volume is measured rather than estimated. Example 2, use a standard 350 ml water bottle marked with lines using a permanent marker, for example, every 100 ml. This helps track intake without needing additional measuring tools. For IV fluids, check the infusion pump or IV bag for the exact amount infused. If a full bag is infused, record the total volume depending on the bag size. For example, if a 500 ml bag of normal saline is fully infused, record 500 ml of NS infused. If only part of the IV bag is infused, use this formula: infused amount equals total bag volume minus remaining volume. For example, 500 ml, total volume, minus 150 ml, remaining, means 350 ml is infused. Always label the IV bag with the remaining fluid to avoid errors. For IV fluids delivered via an infusion pump, follow these steps. Verify the prescription for the ordered rate and total volume. Check the pump display for the accumulated volume infused. Compare the pump reading with the remaining IV fluid in the bag to ensure accurate documentation. To accurately measure output, different methods are used based on the type of fluid. Urine, use a urine bag, male or female urinal. For catheterized patients, empty the catheter bag into a marked water bottle or container for exact recording. Vomiting, use a calibrated vomit bag or basin to measure the volume. To accurately measure output, different methods are used based on the type of fluid. Wound drainage, use gauze weight. Compare soaked gauze to dry gauze. A 5-gram difference equals 5 ml of fluid. Bedridden patients, use diaper weight to measure urine output. Subtract the dry diaper weight from the wet one. For example, a 450-gram wet diaper minus a 150-gram dry diaper equals 300 ml of urine. Chest tube bottle. In many cases, doctors put 400 ml of normal saline into the chest tube bottle before connecting it to the patient. This acts as a water seal. To measure actual drainage, subtract this initial 400 ml from the total volume observed in the bottle. For example, if the bottle shows 550 ml, the actual output is 150 ml. Vomiting, use a calibrated vomit bag or basin to measure the volume. It is crucial to document intake and output properly. Use a chart or a digital app, noting the time, amount, and type of fluid. For example, urine 300 milliliters, clear. Avoid estimating, always measure for accuracy. Warning signs or red flags: fluid overload, weight gain, and swelling. Dehydration, increased thirst, dark-colored urine, and dry mouth. Any of these signs should be reported to the doctor immediately. Key indicators of dehydration include increased heart rate, tachycardia, low blood pressure, hypotension, delayed capillary refill time, more than 2 seconds. Signs of fluid overload include bounding pulse, increased respiratory rate and shortness of breath, decreased oxygen saturation, which may indicate pulmonary edema, jugular venous distension, JVD, swelling in the legs or arms, edema. If signs of fluid imbalance are observed, notify the doctor or nurse in charge immediately. Check and monitor vital signs such as heart rate, blood pressure, respiratory rate, and oxygen saturation. If allowed, adjust IV fluid rates based on the patient's condition and medical orders. Let's consider a real case. A 52-year-old female, post-open cholecystectomy, was NPO for 12 hours, then allowed clear fluids. Her intake in 24 hours included 2,000 milliliters of IV fluids and 580 milliliters of oral fluids, totaling 2,580 milliliters. Her output included 250 milliliters from the drain, 1,000 milliliters of urine, and 120 milliliters of vomitus, totaling 1,370 milliliters. Her fluid balance, 2,580 milliliters, intake, minus 1,370 milliliters, output, equal to plus 1,210 milliliters, which shows a positive balance. If you liked our video, don't forget to give it a thumbs up and share it. We'll keep posting more helpful nursing skills.